Hey guys, my name's Sam and welcome to Prep Medic. This week we're reviewing a huge medical kit. This one is the MyMedic's Medic, and I have mixed feelings. Over the last several weeks, I've reviewed a number of really large medical packs. What sets the MyMedic's Medic pack apart is that this is marketed exclusively to kind of the average person on the street that wants to be extra prepared for certain medical situations. This is not a mass casualty kit, although they do say it can treat a number of people with the supplies in it. This is a kit that goes everything from, boo-boos to, sick call, all the way up to your massive bleeding. Like so many things from MyMedic's that I have reviewed in the past, I'm conflicted with this kit. There are things that I really like that are really unique that you don't see in other kits in this market, but there are also things that I pretty blatantly disagree with their inclusion in a kit like this. We're gonna go through everything. I'm gonna tell you my honest thoughts about all the supplies in this kit. Obviously, this thing is huge, which means one, it comes with a price tag. So I want you to be confident if you are going to pick something like this up that it actually meets your needs and isn't just a bunch of fluff that's going to sit in your car forever that you're never ever going to use. Although it is ideal if you never ever use a first aid kit, it means you're doing something right. The next thing is, obviously, I'm gonna go through each piece. So this video is gonna take a little bit. I'll leave time codes down below where you can see kind of different sections as I go through it. Without further ado, let's start digging into the pack itself. Obviously, we have to start with the exterior of the pack. Honestly, this feels like pretty sturdy nylon on the sides, the top here. Like so many kits, you have a loop field that you can put patches on. They included this little guy, which actually isn't a patch, it's a little clip. So I'm not quite sure what the point of that is. Why not just do a patch? But hey, if you want a little metal trinket, you got that right there. Now down here, you do have a plastic rubber material that does have the loops for MOLLE attachments if you want to put more stuff on the outside of this kit. And then the sides have MOLLE loops as well, where you can attach more things. You can throw on a small fire extinguisher. You can put like your sick call meds on the outside. There's a smaller kit in here that you can MOLLE to the outside, and that'll all work just fine. As far as durability goes, I haven't really had this for any hard use, so I can't really tell you that this is going to hold up no matter what. At first glance, at just kind of getting my hands on it, it feels substantial, but take that with a grain of salt. So as we look at the rest of the kit, every side has a handle. So I've got a handle on the top here, I've got a handle on the side, this side, and then even on the bottom right here. One inclusion I would have liked to see is some MOLLE on the bottom that you could throw on like a litter or something else to carry. It's just an easy place to load your patient movement capabilities. Now on each side you have a water bottle holder, which is pretty nice. In a lot of the medical kits I have, if I want to take it and have some sustainment supplies in there, I'll have to MOLLE one of these on. This comes with it right there. It's expandable. It fits my 48 ounce skinny Nalgene in no problem. And it's got two, one on each side. So to retain the pack, it has this strap right here, branded MyMedic's. You can obviously tighten it, loosen it, depending what you need. And then if you wanted to throw stuff in here, pack it like your litter we were talking about earlier, you can absolutely do so. It just kind of holds everything together. The straps are nothing to write home about. I think they'll be comfortable for maybe a couple miles, but this is not like a heavy duty hiking pack, and obviously it's very heavy because it's huge. The waist strap has a couple MOLLE options right there. As far as I can tell, there's no pockets or any other built-in storage on these. Buckles all seem relatively heavy duty. And then of course the chest strap can be moved up or down depending on what you need. Okay, so as we get into this, one thing to keep in mind with this, it does come with a free March training. I don't know what that looks like. I believe it's an online course, but if you buy this pack, they will give you a training course on their website for free, which is a cool idea because ultimately the supplies in here are totally useless if you don't know how to use them. And that's the biggest thing. I hear all the time people saying, well, I'm gonna carry it even though I don't know how to use it because somebody else might be able to use it. Some people agree with that, some people don't. I usually prescribe to carry what you know how to use, but that's not everybody's thought process, and I totally understand both ways. So let's unclip this and actually get into the part where you want to see. This is not a typical opening, so it will open like a book on either side, just like this. Now, this comes to both a huge positive and a huge negative on this kit. And you can see here we've got a couple different pages in this thing. A huge positive is there's a ton of supplies in here. You can treat a large variety of wounds and not just your massive bleeding, which is what a lot of kits focus on because that's a preventable cause of death. This deals with comfort as well. You know, we'll go through it all, but you've got like blister kits, you got medication kits, you have vitals taking equipment, you have wound closures, you've got airways, you've got a lot of different things in here, which is really, really cool. The negative is that everything is buried and it takes a long time to find. So if I have somebody that's bleeding to death in front of me, I need to be trained up on this kit. And that's not an insurmountable thing to do. You can get in here, you can be trained up on it, know exactly where your bleeding stuff is, pull it out, and be very efficient. However, if you're not opening this pretty regularly and familiarizing yourself with where things are, it can be hard to find the right supplies, and that delay can cost somebody their life, especially when we're talking about massive bleeding, some of these life-threatening injuries. So just be aware that the bigger the kit is, the more parts it has means the more complicated it is to use. On your couch, sitting there doesn't seem like a big deal. When you're panicked, when you have that tunnel vision, when you're in a really stressful situation, your ability to think and find things is greatly diminished. So just keep that in mind as we go through it. Like I said, these are, you know, pages. Oh, here's another one. Didn't even open it up right away and see it. So you have a lot of these pages. As far as I know, it's not customizable. So I can't move these pockets. These are all set pockets throughout the kit, and it's really meant to carry its own things. You can talk to MyMedic about, you know, buying things separately or supplementing. Some people have said they've had good luck with it. Some people said they had no luck at all having them, you know, change different things within the packs that they buy. So keep that in mind. As far as the rest of the interior, you have some elastic loops on either side, which is really nice to just store kind of ancillary things. In my packs that have this, I store gloves in here that are just easy to get at and I can see them. And then we have a sharps container right on the side as well. These are really nice to have because if you are dealing with sharps, it's just an easy, you know, place to stow them. You don't have to worry about throwing them in trash and having some well-meaning person pick it up and stab themselves. And now you've got, you know, a bunch more problems on your hand. You do have two mesh pockets that are currently not filled on either side here. So you can put different things in there. I always recommend carrying some snacks. In any kit you have, throw some snacks in. You can go a couple weeks without food. You're gonna be a lot happier if you're eating regularly. So that's honestly what I'd throw up there. And then of course, the top of the pack has these two pockets as well to throw in some extra supplies if you do want to add to this kit in any way. And I do recommend, even with these preloaded kits, kind of making it your own, figuring out what your threat profile is, what you really want to be prepared of, and adding or subtracting as you see fit. Weight gets to be a big deal when you're carrying these for a long period of time. So if you can slim it down a little bit, that's not always a bad thing. All right, so because I'm gonna get kind of off track with this, let's start with this pocket here, and we're just gonna flip through the entire pack, talk about everything in here. I'm gonna try to kind of get a balance between thoroughness, but also I don't wanna just waste your time for, you know, an hour and a half going through every little thing. So I'll, you know, supplement with graphics on the screen and everything like that. So right here in this top packet, you've got a bunch of these little nitrile glove packets. I do kind of like how these are packaged actually compared to like Talon gloves, just because these are really easy to get out. And they don't come out all like compressed. They come out and they're pretty easy to put on right away. Now from the fit here, I'm gonna say this is probably a large glove. It's usually what I wear and that's kind of what it feels like. Might even say it on there. You have a number of those in there so you can, you know, get these on in a hurry. And like I showed you, they're pretty easy to rip open and take out. Now, what I didn't see is that this is actually like a Ziploc thing, so you can just open that Ziploc. I ripped it and it worked just fine. So, you know, hey, two ways to open that. That's pretty nice in that regard. Coming next to it, we have this guy here, which is basically glucose packets. These are high carb, high sugar packets for somebody that is hypoglycemic. Now, generally, we use these for somebody that's conscious with low blood sugar. I will tell you, and this is not an official recommendation. Official recommendation is you never do this on somebody that's unresponsive. If you have no other option, I know people can take some of that, put it on their finger and rub it on their gums. That's actually called the buccal route. You do have to be careful with their airway. Make sure you're not putting things down their throat, increasing risk of aspiration pneumonia. But if you don't have something like glucagon or D50 and the ability to start an IV, these packets can work for somebody unresponsive. You just get it on their gum and do a little bit at a time. And keep in mind, it's going to take probably half an hour to an hour for them to regain consciousness if blood sugar is in fact the issue. Now in here, we've got a lot of med mods, and this is one of the products from MyMedic I really like because they're really easy to get. They're not that expensive, and they kind of have everything you need. So this one is their medication mod. We've got ibuprofen, we have Tylenol, aspirin, you got some antidiarrheals, Dramamine, diphenhydramine, cold and flu meds. So you have kind of your standard like sick call medications in here. And you have a lot of these packets, 1, 2, 3, 4. 4 of these packets in here, and you've got more than enough meds to take care of anybody. Essentially for as long as you want. Down here, we've got some more mods with different things in them. So this one right here is clean and prep mods. So I'd imagine you've got antiseptic wipe, hand sanitizer, and iodine prep pads. If you're doing a procedure, need to wash your hands, need to clean a wound. This has a lot of the stuff you need in that. Next to that, I believe it's the same thing. So here we've got 1, 2, 3, 4 of these clean and prep mods right here all together. One thing I don't like about the mods, now they're really nice to keep things safe, and it's really nice to be able to like look at this, look at the expiration date, throw it out, get one back. That's a really easy way to maintain your equipment. However, it is, I open the pack, I flip this over, I get it out of this, now I have to open this package, now I have to open the package of the meds. For meds, for this kind of thing, not a huge deal. When we start getting to some of the other stuff, it's just a lot of different layers to get through to get what you need. Not a huge deal, not even necessarily a con, it's just something to keep in mind as you go through it. Next to that, we have our treatment relief mods. So it's like sting relief stuff, triple antibiotic, lip balm, sunscreen, sting relief towelette, white petroleum, hydrocortisone, oral pain relief, 1 ammonia towelette, and 1 thing of chafing cream. So kind of just more of your comfort items. Keep in mind, in this side of this, when you open this up, this comes up. This is your life-threatening stuff. So your life-threatening stuff is on the front. You do have to flip this over to get to some of this minor things. Once again, not really a negative here. Here we've got some topical hyperwash. It's just hand sanitizer right here. You got 3 bottles of that. You have in here your space blankets and a little astronaut head right there. Hypothermia is a huge deal. Space blankets can make a huge difference and conserve body heat. Just make sure you are insulating under that. If you have somebody that has any kind of severe trauma, you should be putting some kind of space blanket on it. Now, right here, we've got burn spray. When it comes to all the burn contents in pretty much any kit I review, I can't tell you exactly what the right thing to do is for a burn for, you know, prolonged field care without the ability to get to a burn center or a higher level of burn care. I have always been taught dry sterile dressings, stop the burning process, dry sterile dressings. We don't put a lot of stuff on massive burns because it just has to be debrided at the burn center. If we're talking about like days in the wilderness, I'm not sure what best practice is, so I'm not the right one to advise you. I'd recommend you go on and learn from somebody that's more of an expert in that. Now, don't think I don't know what I'm doing. I'm not trying to say that. We treat a lot of burns, but every burn I treat, we have quick access to advanced medical facility, and their direction has always been, hey, don't put Silvadene on it, don't put burn cream on it, don't put wet sterile dressings on it. We need to conserve body heat, put dry sterile dressings, and we go from there. And then next to that, we have peroxide spray. So for debriding some of those wounds, you know, everybody had the mom, you know, threw some peroxide on that scrape and it fizzed up and it hurt as a kid, but it was kind of cool at the same time. That's what this is, and there's some mixed messages of if you should be putting that on an open wound or not. Once again, this isn't medical advice, this is just education on this pack. A lot of my stuff doesn't go into kind of minor wound care because that's not what I do professionally. Here we have more burn mods. So we've got a burn relief dressing and burn relief gels. So I want to open this up and just kind of show you what some of these things are. Once again, these aren't things I'm probably gonna put on my patients. So this burn dressing right here, I'm gonna regret opening this because it's super sticky and wet. You've got all of this goop and stuff on here. If you put this on a major burn and you present to a burn unit, they're gonna be mad at you. It might help like the cooling process and everything like that, but as far as using it when you have good access to medical care, I'm not sure it's the way to go. Same with the burn gels. Now, if you've got a minor burn, you're not going to go in and get treatment for it. Okay, I can see the use case just to kind of relieve some of the pain. Once again, though, this isn't something I'm using a ton. I'm gonna get this on the floor without, spraying it everywhere. And now we have our emergency burn care dressings, more stuff. I'll be totally honest, I don't know the huge difference between these. This is much bigger, but as far as, once again, this has like with tree tea oil in it. I'm just not thrilled about the burn stuff in here. It's just not what I'd be treating burns with, in the field long term. Hypothermia for these prolonged burns is huge, and putting something wet on the skin kind of aids in that heat loss from the body. So you have to be really careful getting somebody wet that has burns, because we do want to conserve their body heat. As a lot of tissue gets burned, one of our skin's biggest functions is to regulate our body temperature and to keep homeostasis internally. We damage all our skin, we kind of lose the ability to do that. So for us, keeping them warm is paramount. Wet dressings make me nervous. We come over here, we've got a bunch of paracord. Paracord's great. I love that they have this in the kit. This can be used to, lash tools together. You need to, do a quick sled to get somebody out, or, make a raft, you name it. There's so many uses for paracord. It's not wrapped super tight. You just have a little cord saver on it and it goes right in here. Now we have some glow sticks right in here. Glow sticks are great. They mean different things to different teams, different people. Just have an idea of what these are for. You can use them to light a really low light situation and not use power. You can use them to mark the entrance to a safe area in, school shooting, something like that, a safe corridor. You can use it to, mark a cleared room, or just guide people to where you are. Mark a trailhead with a glow stick for search and rescue to come as you go back to your buddy that's in the woods having a hard time. Now, next to this, I love that this is in here. And this is like I said, I'm conflicted, right? There's some things I don't like. There's some things I really, really like. Right here, we've got a super bivy. So a bivy is basically like a space blanket on steroids that's actually meant to act as kind of a temporary shelter. I carry one of these in my SAR kit. It's something that you can wrap yourself in, survive the night, keep warm. It's just a really, really thick space blanket, essentially, that'll cover your head, keep you out of the elements. It's kind of like an instantaneous shelter. This combined with some stuff over you or a little outcropping, it can save your life. So it's awesome that a bivy is in this kit for a variety of different situations. Now, next to that, we have a lot of blister stuff. So, if you're hiking, blisters can ruin your day really, really quickly. And I made the mistake a number of years ago of trying to break in my Fireline boots, and I got some really, really bad, I forget what they were, like Red Wings or something like that. And I had humongous blisters on my feet, and I could barely walk for a week without something like this. So this is their Super Skin blister packs. It's essentially moleskin. It's their branded moleskin. But it works really well, and then you can cut it to fit if you need to. These ones are just in the, form of Band-Aids, and you can stick it wherever you want. So they work well. I've actually used a couple of their Super Skin mods in real life for some of the ultras I've run. I've kind of preemptively put them on my feet in places I know I get really bad rubbing, and they've worked really well. Now, right here, we've got hydration mods. So this is cool because this actually has some water purification tablets in it, and then it has electrolytes. So a lot of times when we go out on a SAR mission or something like that, somebody comes back, they're really dehydrated. Those electrolytes just really help the body absorb that hydration a little bit better. It's gonna make them feel a little bit better a little quicker. And then the water purification tablets, you can throw those are iodine tablets, you can throw those in water and clean a majority of bacteria out of what you're drinking if you do have to take something from a stream. So we're kind of crossing over into almost like a backcountry thing. Now, this is way too heavy to be hiking with. This isn't a backpacking backpack, but maybe you're stuck in your car for a couple days, or you're on a trailhead or stranded. This has a lot of utility there. Got hand warmers right here, and it's all their branded stuff. So I don't quite know how they make it. So they say built in the US, and I know a lot of this stuff is manufactured here. I don't know if all of it is. So do your own research with that. I'm not sure where all of it is sourced, but I know MyMedic has tried to bring a lot of things in-house to reduce cost. And then you got more hand warmers. I believe you got 4, so 8 hand warmers total in the kit right there. And pretty much every mod I'm pulling out has a ton of different ones in it. There's not really anything that just has one thing. So this is your major bleeding control section, and this is kind of your emergency, life-threatening stuff as we go down. So let's start with the elephant in the room and the thing that throws me off every time I open one of these kits. MyMedic not too long ago bought the Rats Tourniquet, and they've rebranded it to the Rapid Tourniquet. You've been watching this channel for any period of time, you know I am not a fan of these. They're just not tried and true. They're a bungee cord that's great for lashing things to your car, but they've got high occlusion pressures. They kind of came on the market in kind of a shady way. They slip off, they come off with patient movements. They're not really approved by this or recommended by the Committee for Tactical Combat Casualty Care. They don't approve anything, they recommend things. So they just don't have a whole lot of body of evidence around them. Will this work for a lot of people? Yeah, it will work, but there are better products on the market. So I try to steer people clear of the Rats Tourniquet pretty much all the time. This comes with 2 of them. Honestly, I'd take these out of here. Now, the one thing I really like about this kit, and I thought they included this just for me, just to keep me from being too critical, but it comes with this kit standard, is you do get an SOF tourniquet, which this one is TCCC recommended. This is I believe it's, what, they're Gen 5 now, I believe. Here, it's a really nice compact tourniquet. Works a lot like the Cat, a little bit harder for self-application, but it has a number of features that the Cat doesn't have. If you like the metal windlass, it's got a metal windlass. If you like a latch, it's got a latch, slide under their knee, move it up. It even has a bracket here to help you with self-application. The hardest part with these tourniquets is when you put it on your arm, you can't just pull. It's not gonna tighten up. So I either need to slam myself against a wall, I can sometimes brace it in my armpit if I can get my arm steady to get it tight. It's just a little bit hard for self-application on upper extremities. Now that looked pretty easy. The one thing people don't consider is bullets don't just go through soft tissue, they also go through bone. So as that bullet passes through, if you've got a broken humerus right here, it's going to be very, very painful to mash your arm up against the wall or hold it to your body. That's going to be very painful, very hard to do. So that's kind of the one drawback of this tourniquet. Lower extremities, not self-application, all of that, this tourniquet is ideal. It also packs down really, really small. I doubt I can do it like really quick here, but it does have a way to like flat fold. You can pull the windlass off to the side. You can even remove the bracket. And this is a great EDC tourniquet. I think it actually folds up smaller than the Rats tourniquet in a lot of different situations. So really cool that it has that. Down here, we've got some more Super Skin Band-Aids. So we've got Super Skin here, and they're just different sizes of Band-Aids for different things. Are Band-Aids gonna save a life? Absolutely not, but they do make everybody feel better. Just ask my 2-year-old. Band-Aids are a great thing to have on hand at all times. When we do get into the more life-threatening things, we have Quick Clot. We have pressure bandages down here, and these are all their own branded stuff besides the Quick Clot here. Now the difference between this Quick Clot and like the Quick Clot that you see that's like trauma gauze, things like that, is that this is a little bit shorter. It will work for most of your patients. It has enough in it to work for most of them, but it's not the really, really long Quick Clot that you'll see in a lot of IFAKs I've reviewed on this channel. As far as pressure bandages go, super easy to use. They've got directions on the back. Honestly, you can't go wrong with these. These are so easy. Some have like little different things here and there. I find the best pressure dressing is the one you have. And I've never really had an issue, whether that's an Olays, whether that's one of these, whether that's a NAR. There's a lot of different options on the market. This is their own branded thing. And honestly, I've got no issues whatsoever. And you have more pressure dressings here. So you got different sizes, which is kind of cool because one size doesn't fit all. Once again, these can be used to wrap in a junctional site. This can be used to wrap a head wound. You name it, they've got a lot of different uses there for your patients. Now, in here, oh man, we have all of your like minor gauze things. So this has one multi-trauma dressing, which we call like abdominal pads. They're just a huge trauma dressing that can go over the abdomen, cover a wound, go over something a little bit bigger. And then you've got a couple combi pads. So these, well, let's just open it and I'll show you because there's no reason to just talk through it and leave you confused. All right here we've got the multi-trauma dressing. This is like kind of like akin to like global immobilization, where I've got like a patient that's broken everywhere. I throw them on a scoop stretcher or backboard and I just brace everything to itself to keep everything from moving. Same thing for this, except this is like for soft tissue injury. So I'm just gonna throw this over the wound. I can wrap it in, you can put it on somebody's head. You name it. It has a radio opaque line, so if this does get like shoved into the wound a little bit, the surgeon's not going to miss it. Obviously, we're not packing the abdominal cavity, but this could be used to pack like a junctional site if this is all you have right here. So that's a really cool dressing. And then right here, we've got these combi pads, which are the same thing, just smaller. So I open this guy up right here, and right here we've got this smaller pad right here. So you can use this with like an elastic dressing with one of these trauma dressings. Covers things up, keep things free of infection, etc. Right there. All right, you got another one right there if you need to use it. Up here, we've got smaller gauze pads. So it's all the same things, just different sizes. So this has a couple 2x2s, 4x4s, not adherent gauze pads. That's like a gauze pad that's not going to get stuck on like a minor burn if you have it. This is what I'd use for your small burns. I just wrap it with that. And then you've got two different sizes of that, a 2x2, a 3x4. You've got a 2-inch conforming gauze roll and a 3-inch conforming gauze roll. So those are just rolls of gauze. They're not these specific pressure dressings, but if you take one of those dressings I just showed you, you can wrap them in with gauze. Works very well. You can also secure splints with that, you name it, which we'll get in a little bit farther in the pack. I hope you're still hanging with me. There's a lot more to go through on this thing. And like I said, I don't want this video to get too tedious for you there. If you just want to skip this whole video, you can go on their website and see exactly what's in this kit. This is just my thoughts as we go. All right, so in here we've got a lot of different things. One of the things you guys are going to be very intrigued of here is right here. So this kit is kind of an extra little IFAK. Comes with it. You can molly this to the outside of the kit, and it is a wound closure kit. Get so many requests like, oh man, I really want something that, has this. And I want to address some misconceptions and talk about what I think the use case for a wound closure kit is. So opening this up, we have all your little surgical tools right in here. So you got hemostats, you got snippers, you got bandage cutters, you have tweezers, different things for different use cases. You got some surgical blades right here, which are essentially tiny razor blades. Now over here, we've got another thing of gloves. So if you do want to run this on its own, you definitely can. You've got some mini gauze. So this is going to be just like covering that wound after you do what you're doing with this kit. We've got some sanitizer right here, and then you have some site prep things to help ward off infection. The thing you guys, I feel like, are going to really like in here is going to be your actual wound closure contents. So right here, you've got super glue. So this is not your commercial super glue. It's made, it's non-toxic, can be put, on a wound, close that up. And then in here, you have sutures. Actually, nylon sutures with needles. This is where we get to the misconceptions that I want to talk with. Sutures are a cosmetic fix. These are to keep infection from getting into a large wound, and they're to close a wound with minimal scarring or less scarring than it would have if it just closed on its own and healed. These are not emergency bleeding interventions. Sutures, super glue, these zips, which essentially, they're like steri strips almost, and they bring the wound together. They're just a little easier to use. These are not for massive bleeding. These are for cosmetics and to keep infection out of the wound. Suturing is more complicated than you think it is. Yes, the basic knots are pretty easy. All of that. There's not too many paramedics in the United States that do sutures just because there are a lot of different kinds of wounds. You can do internal sutures, you have a lot of different knots, you have different ways to close it neatly, and it takes a lot of practice. So if you're trained on this, you can absolutely do it. There is definitely a use case for sutures, but this isn't something like a plug and play, hey, I sewed my kid's doll up once and now I'm going to be able to do this. It's not quite that easy. So not a bleeding control item, but still kind of interesting that it comes, in this kit. Along the same lines, and I'm jumping a little bit out of order, but it goes with this kit very well. This thing is super sturdy. It's got a molly backing, and then it also can be ripped off of that and taken to a victim. Along the same lines, they have something that everybody asks about in every kit. They have a skin stapler. So this is for staples, a little bit easier to do than sutures, but once again, this leaves a little bit more of a scar, not bleeding control. This is not for bleeding control. This is for closing the exterior of the skin. A lot of times staples are used on scalp wounds. You should only do this if you're trained to do this. If you start suturing or stapling somebody on scene, you are not going to be covered by a Good Samaritan law. So I see this being more like, hey, we don't have access to good medical care. Maybe this is somebody's expedition pack for, an African safari or something like that, and you don't have a good hospital near you, you can use this guy. So I know this is going to excite a lot of people that it comes with this. And right on the back, it has the expiration date. This one expires in 2026 before it needs to be replaced. So kind of interesting that that's all in here. Now, as we come up here, we've got a couple more wound closure things. So we've got a bunch of these super glue kits. That's kind of a standalone kit. Right there, you got 2 MyMedic branded trauma shears, one big, one small. These are gonna work for a couple uses. I say this every video. I like expensive shears. These are gonna work just fine if you're not cutting somebody's clothes all the time. They just might have difficulty getting through a little bit of thicker material. And then in here we have a tool set. So these tool sets come with a number of different things, which I will open and show to you. In here, I've got a thermometer. Right here, I have a pen light with a little strap so it's not gonna, lose its capabilities. I've got tweezers. There's a lot of tweezers in this kit, which is actually good. And then I've got a whistle. Obviously, there are a lot of different uses for these tools right here. Just good assessment techniques here. Good thermometer right here. Quick joke. Do you know the difference between an oral and a rectal thermometer? It's the taste. So those all go in here, and you have 2 of those kits in this pack that you can open at your leisure. We've got a tape mod with a lot of different kinds of tape in it for different securing. It's one of those things that I use tape almost every day in my job, whether that's securing a bandage, securing an IV, or just like taping IV lines together if I need that. Really, really useful to have. All right, so next down the list, we have a bunch of nasal pharyngeal airways, and these are 2 different sizes right here. So I have our 28 French and a 20 French. Those are pretty standard sizes. It's kind of cool that they've differentiated the sizes because a lot of these kits only come with the 28 French, which is a kind of a military standard because it's a standard size for military-aged males. So as I open this here, I can get into it. Once again, package inside of a package inside of a package. So be a little bit cautious of that. When I open this up, I have an MPA guide, which I'm not a huge fan of these because I found that I lose the ability to read when I get stressed out. So you should be practiced on these, but this might be a good reminder. Some people really like these directions right here on how to do it. I've got a video on this you can check out in the link where I actually do it to a friend of mine, poor guy. But here we've got 28 French. I don't care for these kinds of MPAs with this kind of odd flanged tip because this tip right here is not very sturdy and it's a little bit hard to see, on camera. But what I've found is when this is inserted, it's really easy for this to get pushed farther into the nair. And I've actually had a patient where I buried 2 of these before I realized I had already inserted one. It had just gotten sucked back a little bit. So not a huge fan of these MPAs specifically. They do work. I'm not saying they don't work. You just have to be cautious that this isn't going into the nair very well or very far. We've got some gloves. Once again, there's a million pieces of PPE in here. We've got antiseptic towelette. Not really sure why we need that for an MPA insertion. I don't know why we need that. And then we have some lube to help that slide back. We don't just want to shove it in their nair. That's not very fun for anybody. In here, we've got a bunch of N95s. So these are kind of your high particulate masks. Be aware that you can't just put on any N95. There are different sizes to it. Most of us are going to fit like a medium, but there is some variation there. And if you have facial hair beyond a mustache, it's not going to give you the right seal. Now, I went a long time wearing an N95 on a beard, and it always worked for me, but when it gets really, really small particulate, you might run into some issues, and you might not be able to pass a fit test if you're required to do that for your work. In here, we've got MyMedic branded chest seals, and they're paired. So you got 2 right in there, presumably for an entrance-exit wound for a gunshot wound. And these are kind of an interesting valve. So right here, we've got our antiseptic towelette. You can clean the area, get blood off it. You've got this guy right here, and this is purely to get blood off around that chest when you're doing this, so it actually sticks. And you have the chest seal itself right here. These are astronomically sticky. This looks like more of a laminar valve, which has been shown to be more effective than some of the other valves on the market here. And then this guy's going to go right over that chest wound, and in theory, it will vent from a tension pneumothorax. If you're carrying chest seals and you don't know what a tension pneumothorax is, I encourage you to go do your homework and figure that out, just because that is a risk of putting on a chest seal on a patient. So there are those, and you got a bunch of chest seals in here. Now we've got cold packs right here. Important to have. One thing to note is that the whole rice mnemonic for soft tissue injuries, that rest, ice, elevation, all of that stuff is really going away. If the pain's intolerable, if you want to get rid of some swelling right away, ice packs work great. They're a great comfort item. As far as healing goes, they actually slow down the healing process. So because that inflammation that you see, that like ballooning of that leg, it's actually the body trying to get nutrients down to it. So it'll help with pain, delays healing slightly. I'm not saying not to do it. I'm just saying long-term, ice probably isn't the answer for you in a lot of those sections. So we're getting to the last pocket of this kit. I don't even know how long we've been going so far, but there are some cool things in here and some things I kind of disagree with. Let's start with something I disagree with. We have two C-collars right here. So we've got a pediatric adjustable size C-collar and we've got an adult adjustable size C-collar. These are for our suspected C-spine injuries. We still use these professionally. If we have a patient that is in a massive motorcycle wreck, that has neck pain, that has loss of consciousness, that has distracting injury and a massive mechanism of injury, we're going to throw a C-collar on. That being said, the data behind C-collars is almost nothing. We see almost no benefit to these and actually potentially some harm. So it's still standard of care, but it's one of those things that we started doing because in theory it works, but the data just isn't panning out to support the use of these. So if I was to take something out of here to save some weight, honestly, I'd take the C-collars out. The instances of somebody having an unstable C-spine injury, turning their head and, collapsing dead because you severed their spinal cord is relatively rare. Like actually, I don't know if it's ever actually happened. Generally speaking, with these massive C-spine injuries, they are either massively injured or they're not. So it's not to say that we shouldn't take spinal precautions. We have them not move. We try not to jostle and we tell them not to move their head because it's an orthopedic injury. You can damage people a little bit more if they're moving around, but these C-collars don't hold somebody in a good position. They're uncomfortable. They cause the patient to squirm a little bit more. They can cause pressure issues over time if they're left on. There's just a lot of controversy around these. So they have them, but know their limitations and understand what you're actually doing that helps and what really doesn't have much effect on the patient. Now, coming down here, we have two of these, and these are our fracture mods. So let's open this guy up right here. They're purple. They're all color-coded, which is cool, but honestly, I can't remember what's what in any of these. And you can look at it on the website, but you need, something to interpret all of it. So this is everything you need to splint an arm, a leg, a finger right in here, which is a big deal. And you should know how to do this. This is a really easy skill. It's not going to do a lot of harm to the patient. It's going to help them. Obviously, like we were talking about with the neck injuries, it's an orthopedic injury. We want to keep those bone ends from rubbing together, damaging vasculature, wearing down those bone sides. It can actually severely decrease the recovery time for a patient to have good splinting at point of injury. So right here, we've got a finger splint, which this is cool. I haven't actually seen this. I haven't actually opened this mod before. So right here, this is going to go around your finger and you can splint it just like this. Pro tip, if you don't have a fancy finger splint like this, which this is more comfortable, you can actually do a buddy splint. So if they didn't break all their fingers, you can just splint two fingers together with tape. It works really, really well in a lot of situations. But this is a cool little device to have. Next, we've got kind of their version of the Sam splint right here. So it's their branded thing, but it's a very, very similar concept. So these splints are really, really versatile. They have a diagram for different ways you can use it right on the front. Now these get their stability by basically making them into a boat shape, because obviously I can bend it right now, but if I curve it up on their uninjured extremity, that makes it easier to put on the arm and immobilize it. When we're immobilizing an arm, keep in mind, if it's a long bone, we're immobilizing the joint above and below. If it's a joint, we're immobilizing the long bone above and below. I think I said that right. So right here, it's got a bunch of different uses for the arm and the leg. And the inside of this is actually a really interesting material. This is something that Sam Splint doesn't have, but it's more of like a comfort foam pad. I know Sam Splints are radiolucent, which means that you can see them under or you can't see them under an x-ray, so you don't need to remove the splint to do it. I don't know if these are radiolucent or not. So do some research before you do it. You got a triangular bandage. These are great for slings, swaths. This is something where we've splinted their radius ulna. I'm now gonna put it right in front of them like this and hold it. It's just more comfortable, decreases swelling, all of that good stuff, and it just holds it tight to their body. We used to do that all the time as ski patrollers. We've got a elastic bandage here, and then we've got Co-band, very, very similar, used to wrap the splint on, or you can do what's called a swath, which is around that sling to hold it into the body and keep them from moving around too much. And then right here, we've got our mini sprain and fracture mod. So what I'm assuming is in here is, yeah, you've got a finger splint And then you've got a self-adhesive bandage rule. So if you did need to wrap somebody's ankle, they've got a sprain, you want to hike them out, you can wrap it pretty tight with that and go about your day, get them out of the backwoods. Self-rescue is a big thing when it comes to SAR, even if it's a less ideal situation of having the patient walk out on their own. So down here, we've got some more airways. We've got OPAs. Once again, honestly, OPAs are fine. We still can use them. I haven't used an OPA professionally in years. So these are an airway that goes in the mouth similar to the NPA that we were talking about before. The difference is these can't be inserted in anybody that has a gag reflex. So most of the time when these are being inserted, they're being inserted in somebody that's in cardiac arrest. You can put in 2 MPAs, an OPA, and you're gonna have a really clear airway. There is a use case for them. However, since these can only be used in a very specific case, and these can be used in literally anybody, the NPAs can be put in almost anybody, with some small exceptions. Once again, I have a video of it. The use case just isn't that broad, and they're doing what this does. If you want to save some space and some weight, I'd honestly take these out of the kit. They're just not my favorite thing. I don't carry them in any of my own kits whatsoever, just because I just don't use them a whole lot. And back in here, we have CPR masks. So remember how I said that like all of the life-saving stuff was up here? I guess this is the exception to that, is these guys right here, these CPR masks for mouth-to-mask respiration are kind of buried in this kit. I don't like that a ton. So I'd move these a little bit closer, a little bit easier to find, or just train up on this pack and know where it's at. So these give you a barrier to their mouth, and it lets you go breathe through a one-way valve. I'll tell you, I will not do mouth-to-mouth unless it is a close family member or my son. So we still teach 30 to 2 CPR to breaths. However, chest-only CPR, like just compressions only, is going to be very effective for patients. This can be useful if you have somebody that like, hey, they've got a narcotic overdose. You need to breathe, give them rescue breaths, or they have a head injury, they have disordered control of breathing. This will allow you to do rescue breaths for a patient, like 1 breath every 6 seconds ish for them. In CPR, if you're trained to do 30 to 2, this will allow you to do it, 30 compressions, 2 breaths, and it keeps you relatively safe from pathogens and vomit and all the other lovely things that happen to somebody that's severely injured and unresponsive. So that's this right here, and then use that in conjunction with, you know, some kind of airway if you can. Right there, and you've got a bunch of them. You had four of them right there. So hopefully you're not using all 4 at the exact same time. That's a really, really bad day for you. Next, we have diagnostic equipment, which we don't see diagnostic equipment in a bunch of different kits. So this right here is going to be your stethoscope. Oh man, trouble with the zipper. Not a high quality zipper on this kit. I'll get it eventually. Well, that's frustrating. There you go, got it. Something was caught internally. Luckily, it's not like life-saving equipment, so, you know, whatever, I guess. So in here, we have a pretty cheap stethoscope right here. It's gonna do the work you need it to do, but this is kind of, I don't know, about as cheap as you can get as far as stethoscopes go. It has 2 bells on it, high tones, low tones. There, it will get the job done for taking a blood pressure and listening to quick lung sounds, but it is nothing fancy. You've got some replacement earbuds, and then the diaphragms if you lose them on this side or this side right here. And then you have your sphygmomanometer, whatever, blood pressure cuff right here. This is kind of a standard size. You line this up with the artery, put it on, pump it up, let it down, and you do have to connect the actual manometer to it right here to get your blood pressure. I have a video on how to take a blood pressure as well if you're interested. Fine, once again, pretty cheap blood pressure cuff, but it's going to work for you if you have to monitor your patient for a longer period of time. Train on it, use it. This is a tool that can be used multiple times, so there's no reason not to open this kit, pull it out of the wrapping, get used to it, take some blood pressures, subject your, you know, wife, kid, girlfriend, boyfriend, whoever, to that. All right. Next up, and like starting to get to the end of this, we've got a staple remover for that staple gun I showed you earlier. You're gonna remove these after, you know, a number of days for the patient. I don't actually know how long staples are staying in right now or what their recommendation is. You got 2 of those. And then kind of your last diagnostic piece of equipment right here is a pulse ox. These are a cool piece of equipment and they work really well in a lot of different situations. Clearly can't open it very well. That's not their fault, that's my fault. There, so This guy, let's see if it actually comes with batteries. Doesn't come with batteries. It looks like it takes two triple A's on the inside. This goes on the finger. It's going to show you your heart rate and your pulse oximetry. Now, you need to know the limitations of pulse oximetry. It will tell you the percentage of hemoglobin in your blood that is oxygenated. So normal is anywhere between 94 and 99% to 100% for a patient. Now, this will not differentiate different gases bound to hemoglobin. So if you have somebody that's been in a carbon monoxide leak, this can show 100% because carbon monoxide has a really high affinity to hemoglobin and it kicks off those oxygen molecules. So this will say 100%, but they're super hypoxic, they're super low in oxygen. That's a problem. This won't tell you there's an issue there. This also will not work on patients with really circulation issues in their hands, with really dark nail polish, somebody that's really cold in the extremities. These have a lot of different issues. Or if you have a lot of ambient light, especially like in the helicopter, we'll have a pulse ox on and that rotor flicker will make this error very, very quickly. Generally speaking, these will not give you a false high with the exception of something else binding to the hemoglobin, but they can give you a false low. So there are limitations to this device, but it's a really easy way to just monitor somebody's pulse and kind of see their breathing status in a majority of situations there. So it's cool. I really like that they've included diagnostic equipment. Once again, though, if you're not trained on it, it's almost useless. So make sure you're training on this, take some classes. If somebody really wanted a class that covers everything in this kit, with the exception of sutures and staples, go take an EMT class. So there are a lot of different levels of providers. EMT is kind of your entry level realm into the pre-hospital environment, and that will teach you the majority of what you need for this kit. Generally speaking, an EMT class can be anywhere between a semester, or if you do an accelerated one, to 4 to 5 weeks. So it's not as big of a time investment as you believe it is. And then just a couple other things. You got more bungee things on the side here. So finally, we have come to the end of this kit. Obviously, there are a ton of supplies in here, and this does have a lot of potential for the right person. Just be aware of the limitations on a kit like this and know before you buy and invest $1,200, $1,400 in a kit like this, what it's used for and what it's not. If you have any questions, please leave them in the comments down below, and I will see you next week.